Mole or mil. 5 signs that save lives in the complex tapestry of our skin. Moles often appear as benign, everyday marks, yet they hold a critical secret. Some can evolve into melanoma, a serious form of skin cancer. The distinction between a harmless mole and a potentially deadly melanoma is not always obvious to the untrained eye, but understanding the subtle differences can literally be a matter of life and death. This isn't about inducing panic, but empowering you with knowledge, transforming you from a passive observer of your skin into an active participant in your health. We're going to delve deep into what makes a mole, what triggers the dangerous transformation into melanoma, and crucially, the 5 vital signs that could save your life. Your skin is your body's largest organ, a protective barrier, and a silent storyteller. It's time to learn its language. Understanding moles, the basics and beyond. Moles, medically known as nevi, are common growths on the skin that can vary in color, shape, and size. They typically develop when pigment-producing cells in the skin, called melanocytes, grow in clusters. Most people have between 10 and 40 moles. And while the majority are harmless, it's essential to understand their characteristics. Moles can be flat or raised, smooth or rough, and may have hair growing from them. They can appear at birth or develop throughout childhood and adolescence. Sun exposure plays a significant role in their development, and certain genetic predispositions can also influence their number and type. While benign moles usually remain stable over time, any changes in an existing mole or the appearance of a new, unusual mole should prompt attention. Knowing your own skin and regularly performing self-examinations are the foundational steps in early detection. The malignant transformation. When a mole becomes melanoma, melanoma arises when melanocytes become cancerous. Unlike many other cancers, melanoma often begins on the surface of the skin, making it highly visible and potentially detectable at an early, curable stage. However, if left unchecked, melanoma can rapidly spread to other parts of the body, including vital organs, making treatment far more challenging and the prognosis significantly worse. The exact cause of melanoma isn't fully understood, but intense, intermittent sun exposure, especially blistering sunburns during childhood, is a major risk factor. Genetics also play a role. Individuals with a family history of melanoma or a large number of moles are at higher risk. It's crucial to understand that not all melanomas arise from existing moles. Some can appear on previously clear skin. This underscores the importance of a comprehensive skin check, not just focusing on existing moles. The ABCDEs of melanoma, your essential checklist to simplify the identification of suspicious moles. Dermatologists developed the ABCDE rule, a powerful mnemonic that provides 5 clear indicators of potential melanoma. This framework is designed to empower you to conduct effective self-examinations and to know when to seek professional medical advice. A is for asymmetry. Harmless moles are typically symmetrical, meaning if you were to draw a line through the middle, both halves would match. Melanomas, on the other hand, are often asymmetrical, with irregular shapes that do not mirror each other. B is for border irregularity. Benign moles usually have smooth, well-defined borders. Melanoma borders tend to be uneven, notched, or scalloped, often with a blurry or fading edge. C is for color variation. Moles typically have a uniform color throughout. Melanomas, however, often exhibit multiple shades of brown, black, tan, white, red, or even blue within the same lesion, creating a mottled or patchy appearance. D is for diameter. While not an absolute rule, melanomas are often larger than 6 millimeters in diameter. Any mole that is growing in size, regardless of its initial dimensions, warrants attention. E is for evolving. This is perhaps the most critical sign. Any change in an existing mole, in size, shape, color, elevation, or any new symptoms like itching, bleeding, or crusting is a red flag. Similarly, the appearance of a new, suspicious-looking lesion should be promptly evaluated. Beyond the ABCDEs, additional warning signs and risk factors. While the ABCDEs are the cornerstone of melanoma detection, it's important to be aware of other potential warning signs and risk factors. Moles that are painful, itchy, or bleeding without trauma should always be investigated, even if they don't fit all the ABCDE criteria. Lesions that feel lumpy or firm, or that have a scaly or crusted surface, are also concerning. Individuals with fair skin, light hair, and blue or green eyes are at higher risk due to lower melanin protection. A personal or family history of melanoma significantly increases your risk, as does having a large number of moles, or atypical moles. Regular, unprotected exposure to ultraviolet radiation from the sun and tanning beds is a primary environmental risk factor. Understanding your personal risk profile is crucial for proactive skin health. The power of self-examination. How to be your own first line of defense. Regular self-examinations are a simple yet incredibly powerful tool in the fight against melanoma. Dedicate a few minutes each month to thoroughly check your skin from head to toe. Use a full-length mirror and a hand mirror to inspect hard-to-see areas, like your back, scalp, and the soles of your feet. Pay close attention to areas not typically exposed to the sun, as melanoma can occur anywhere on the body, including the fingernails and toenails. Documenting your moles through photographs can be helpful for tracking changes over time. If you notice any suspicious changes or new lesions, don't hesitate to contact a dermatologist. Remember, early detection is paramount, and you are your own best advocate when it comes to noticing subtle changes in your skin. Professional checkups, the indispensable role of your dermatologist. While self-examinations are vital, they are not a substitute for professional dermatological checkups. Dermatologists are trained experts in skin conditions and can identify subtle signs that might be missed by an untrained eye. They can use specialized tools like a dermatoscope to examine moles more closely, and if a lesion is suspicious, they can perform a biopsy for definitive diagnosis. The frequency of professional skin exams depends on your individual risk factors. If you have a history of melanonumerous, atypical moles, or significant sun exposure, your dermatologist may recommend more frequent checkups. Establishing a relationship with a dermatologist and adhering to their recommended screening schedule is a critical component of a comprehensive skin cancer prevention strategy. Don't wait until you find something concerning. Proactive screenings can catch issues before they become serious. Empowering yourself for a healthier future. The journey of understanding moles and recognizing the early signs of melanoma is an empowering one. It transforms fear into knowledge and uncertainty into proactive vigilance. Remember, moles are a natural part of our skin, but being aware of their characteristics and the potential for change is fundamental to safeguarding your health. The ABCDEs, asymmetry, border irregularity, color variation, diameter, and evolving, are not just medical terms. They are your life-saving toolkit. Regular self-examinations coupled with professional dermatological checks are your strongest allies in the fight against skin cancer. Don't underestimate the power of early detection. It truly saves lives. Take control of your skin health, be informed, and be proactive. If this information has resonated with you and empowered you with vital knowledge, please consider subscribing to our channel. By subscribing, you'll stay informed about crucial health topics, receive regular updates, and become part of a community dedicated to Share this video with your friends and family, because spreading awareness can genuinely save lives. Your support helps us continue to create content that matters. Subscribe now and join us in building a healthier future.